Hi, I'm Dr. Lin. I want to show you a map of a patient where it was suspicious for form frust keratoconus. So I want to highlight this as the first map, the epithelial map. And the first thing we want to do is actually focus to get zoomed into this area here. So you notice here, the cursor goes as 57 and this is 55. So we're talking about very small, distances here, 52 microns. But we want to get as much power in there and zoom to optimize the use of the scale. So up here is, that's not something that we're concerned about. So we don't really need 40 and even 60. So you can click on the black arrow and go to adjust scale. And we'll just put in a number here. I think more like 50. And then we can keep it at 60 and then just put OK. So it just gives us a little bit more power so that now we have different colors here that we can see. Now it highlights here 55, 58, and this is steeper. So what we want to do is you can now adjust this arrow here to see. So what I usually look for is the first area that becomes the thinnest, that becomes a thinner. So we don't care about this part because it's not relevant, because look at the scale here. This is 10 millimeters out here, okay, 0 to 5 here. So what I do is I adjust this so that the first area in the area of relevance, it turns green. Okay, so right here is where we're seeing the green first indication. So I look at it as like 55 versus 55.4, 55.6. There's really not much of a change here. So what a normal map is that it becomes steeper as we go inferior. So this is not completely normal. There's a little bit more thinning centrally. So we'd be looking in that central area to see if it's a central keratoconus. On the topography map, is there any posterior elevation in that area? Okay. And then this map here talks about the standard deviation from normal. So even though it is thicker down here compared to here, the normal pattern is there's actually more thickening than, this whole thing ideally should be right here. But there's not much difference. So there is a little bit of relative thinning compared to a database of normal patients, but this is really not that much difference. But again, it's not a perfect map. And sometimes it's not perfect. So the point is, now we take this information and how do we interpret that? These we don't usually look for. By the way, this is very useful also for post-operative flap, like LASIK, so you can look at the previous flap thickness, so you can decide whether to relift the flap or to create a new flap that's thinner, or to do PRK. If there's scars, it's very useful to look at all these information. And then finally, this here is the RSK, the risk score, is below normal here. It just tells you that the average person in the database should be in this area with this standard deviation. This patient falls in this area. And this is just looking at a bunch of different epithelial mappings and comparing it to a database. So this gives us a little bit additional information. So in this case, we'll have to look at the anterior topography, the posterior elevation, and all this information together to come up with a conclusion. But I just wanted to show you exactly how to adjust the scale to optimize interpreting this